Good morning, everybody. I'm Dr. Asif Umar. I'm a senior consultant in the Department of Minimal Access and Bariatric Surgery at Accord Super Specialty Hospital, Faridabad. Today, we are going to talk about obesity. So, what is obesity? Obesity is an abnormal accumulation of fat in our body, which can lead to medical illnesses. Obesity was declared as an epidemic by WHO in 1997, and in 2003 American Medical Association defined that obesity is a syndrome which is associated with many other metabolic issues. There are about 1.9 billion people in the world who are overweight and 650 million people are obese. In India only there are about 135 million people who are obese. And this obesity is associated with many other medical issues like diabetes, hypertension, osteoarthritis, sleep apnea. So this is a large burden on our society. So how do we assess obesity? Obesity is assessed by an index which is called body mass index or BMI, which is a ratio of the weight of the person to square of the height of the person, and it is just a number. If this number falls between 18 to 23, it's a normal BMI. Between 23 and 25, it is overweight. And if the BMI is between 25 to 30, it's called class 1 obesity. From 30 to 40, it's called class 2. And more than 40, it's called class 3 or morbid obesity. So what is the etiology of this obesity? Earlier, it was thought that obesity is just an imbalance between our intake and the energy output, but now it has been realized that obesity is related to many other metabolic, genetic and hormonal factors. It is related to some drugs which we are taking. It is related to the physical activity and what type of food we are taking. So what is bariatric surgery and how does it help us? Bariatric surgery is done by laparoscopy, and in this we make certain changes in our stomach and small intestine, and there are two types of bariatric surgeries. One is a restrictive type and another is a malabsorptive type, and third one is a combination of both. So in bariatric surgery the food is restricted and there is malabsorption of food, which helps in reduction of the weight, and when the weight is reduced, other comorbidities which I have discussed, they are also controlled. So what is the preoperative preparation? This surgery is done under general anesthesia, and we do some routine checkups of the patient and for assessment of the fitness, and we also rule out certain metabolic conditions before doing the surgery, and we put the patient on liquid diet depending upon his BMI, which may range from like 3 days to a week, and we start certain respiratory exercises so that there are no complications during the surgery and in the post-operative period. So what are the post-operative precautions and what is the post-operative management? Post-operatively, patient is mobilized 4 hours after surgery, and we start liquids 6 hours after surgery, and the patient is usually discharged on day 1 or day 2 depending upon his condition, and we keep the patient in follow-up. For first year, the follow-up is required after every 3 months, and second year the follow-up is required 6 monthly, and then we do a yearly follow-up with certain blood investigations, weight and ultrasound. So what are the current trends of weight loss surgery? So earlier, as I said, that it was thought that the weight of the patient is just an imbalance between the energy intake and energy output, but now that we have realized that it is a complex procedure, involves certain metabolic, genetic and hormonal factors. So attempts are being made to find out these pathways so that we can customize a procedure for a particular individual. Thank you so much.